What if I told you that just 5 simple habits could mean the difference between a healthy, strong prostate and years of painful problems after 60? Most men don't realize how much control they actually have over their prostate health until it's too late. But today, I'm going to show you how to take that control back, starting now. When it comes to protecting your prostate after age 60, nothing influences your health more powerfully than the food you put on your plate. Nutrition is the foundation of prevention, and science consistently shows that specific nutrients can either fuel inflammation and disease or fight against them. The prostate is a small gland, but it is extremely sensitive to hormonal changes, oxidative stress, and inflammation, all of which are deeply connected to diet. This means that every meal you eat is an opportunity to either harm or heal your prostate. The good news is that nature gives us an abundance of foods that actively protect this vital gland and lower your risk of conditions like benign prostatic hyperplasia, BPH, and prostate cancer. One of the most important compounds for prostate health is lycopene, a powerful antioxidant found in tomatoes, watermelon, and pink grapefruit. Lycopene helps neutralize free radicals that damage prostate cells and has been shown in multiple studies to reduce the risk of prostate cancer progression. Cooking tomatoes in olive oil significantly boosts lycopene absorption, so a simple tomato-based sauce or soup can deliver incredible benefits. Alongside lycopene-rich foods, cruciferous vegetables like broccoli, cauliflower, kale, and Brussels sprouts contain natural compounds called glucosinolates, which support the body's detoxification systems and help eliminate excess hormones linked to prostate growth. These vegetables are also packed with fiber, which keeps your gut healthy, a key factor because poor gut health is linked to systemic inflammation that can affect the prostate. Healthy fats are another critical piece of the puzzle. Instead of relying on animal fats, which can drive inflammation, choose plant-based sources like nuts, seeds, avocados, and olive oil. Walnuts, for example, provide omega-3 fatty acids that help calm inflammatory processes in the body, while flax seeds deliver lignans that support hormonal balance. Green tea, rich in catechins, is another dietary powerhouse with proven benefits for prostate health, as it helps regulate cell growth and reduce oxidative stress. Incorporating these foods isn't about a strict diet, it's about making smart swaps and turning everyday meals into a protective shield for your prostate. Every bite matters, and over time, these choices add up. A plate full of color, deep reds from tomatoes, greens from cruciferous vegetables, and the golden richness of olive oil is not just visually appealing, but a scientifically backed strategy for protecting your prostate. The goal is consistency. Small, deliberate choices made every single day can create an environment inside your body that resists disease and promotes long-term health. When it comes to preserving prostate health after 60, exercise is far more than a way to stay fit. It functions like medicine for your body. Movement directly influences hormones, circulation, inflammation, and weight management, all of which are critical factors in maintaining a healthy prostate. A sedentary lifestyle, on the other hand, creates the perfect environment for problems like benign prostatic hyperplasia, BPH, urinary difficulties, and even a higher risk of prostate cancer. Scientific studies have repeatedly shown that men who engage in regular physical activity have a significantly lower risk of developing prostate-related issues compared to those who remain inactive. The reason is simple. Exercise is a natural regulator for the systems that impact prostate health the most. One of the most powerful effects of exercise is its ability to improve circulation. Good blood flow means better delivery of oxygen and nutrients to the prostate and surrounding tissues while removing toxins and reducing congestion in the pelvic area. Activities like brisk walking, cycling on a comfortable seat, or swimming can dramatically enhance pelvic circulation, which is vital for prostate function. Beyond circulation, exercise plays an essential role in hormonal balance. After 60, men tend to experience fluctuations in testosterone and estrogen levels, which can contribute to prostate enlargement. Physical activity helps regulate these hormones naturally, lowering excess estrogen and maintaining healthy testosterone levels, creating an internal environment that supports prostate health. Another critical benefit of daily movement is its impact on weight control. Excess body fat, especially around the abdomen, is linked to increased inflammation and insulin resistance, two conditions strongly associated with prostate enlargement and cancer risk. Engaging in regular exercise reduces body fat, which in turn lowers systemic inflammation. Even moderate activities, such as 20 to 30 minutes of brisk walking or light resistance training, can significantly reduce inflammatory markers in the body. Resistance exercises like squats, lunges, and lightweight training help build lean muscle, which not only supports metabolism but also stabilizes hormone levels that affect prostate tissue. Stress management is another hidden advantage of movement. Physical activity lowers cortisol levels, the stress hormone that drives inflammation and weakens immune defenses. Chronic stress has been linked to worsening prostate symptoms, and exercise acts as a natural stress reliever by releasing endorphins that calm the nervous system. This means that making exercise a daily habit doesn't just strengthen your body, it actively creates an internal balance that protects the prostate on multiple levels. Hydration plays a critical role in maintaining prostate health, especially after the age of 60, when the body's ability to regulate fluids changes and the risk of urinary complications increases. Water is essential for flushing toxins and metabolic waste products from the body, reducing the chances of these substances irritating the prostate or causing infections in the urinary tract. When hydration levels are adequate, the bladder and kidneys function efficiently, which indirectly supports the prostate by preventing urinary stagnation that can lead to bacterial growth. However, hydration is not just about drinking more water, it's about drinking the right amount at the right time to balance health benefits without creating unnecessary strain on the bladder, particularly during the night. Many men struggle with frequent nighttime urination, known as nocturia, which becomes more common with age and can significantly disrupt sleep quality. Poorly timed hydration is often a hidden cause of this problem. Drinking large amounts of water or other fluids in the evening can force the bladder to work overtime at night, leading to multiple trips to the bathroom. This interruption in sleep can increase stress levels, weaken immunity, and negatively impact hormone balance, all factors that indirectly affect prostate health. The key is smart hydration timing, consuming the majority of daily fluids earlier in the day and reducing intake within 2 to 3 hours of bedtime. This approach ensures that the body stays hydrated without overwhelming the bladder at night. The type of fluids you choose is just as important as the timing. While water should be the primary source of hydration, certain beverages can either help or harm the prostate. Drinks high in caffeine, such as coffee and some teas, act as diuretics, increasing urine production and potentially irritating the bladder and prostate if consumed in excess. Similarly, sugary beverages and alcohol can promote inflammation and dehydration, creating conditions that are unfavorable for prostate health. On the other hand, herbal teas like chamomile or green tea, consumed earlier in the day, can provide antioxidants and mild anti-inflammatory benefits without causing excessive urinary urgency. Monitoring hydration needs is also crucial because as men age, the natural sense of thirst diminishes, leading to an increased risk of dehydration without obvious signs. A simple way to gauge hydration is by observing urine color. It should be light yellow, not dark or overly clear. Incorporating water-rich foods such as cucumbers, berries, and citrus fruits can further support hydration while delivering valuable nutrients for overall prostate and urinary system health. Chronic stress is one of the most underestimated factors affecting prostate health after the age of 60. While most people associate stress with mental strain or emotional discomfort, its impact on the body runs much deeper. Persistent stress triggers a hormonal cascade, particularly increasing cortisol levels, which is the body's primary stress hormone. When cortisol remains elevated for long periods, it creates a state of chronic inflammation that can silently damage tissues, including the prostate gland. Inflammation is a major driver of prostate enlargement and contributes to conditions such as benign prostatic hyperplasia, BPH, and even increases the risk of more serious complications over time. This means that managing stress is not just about emotional well-being. It is a direct strategy to reduce the biological processes that harm the prostate. Stress doesn't just raise cortisol, it also interferes with immune function, making the body more vulnerable to infections, including urinary tract infections that can aggravate prostate issues. High stress levels can also lead to unhealthy coping mechanisms such as overeating, drinking alcohol, or avoiding physical activity, all of which further compound inflammation and hormonal imbalances. Over time, these patterns create a vicious cycle. Stress fuels inflammation, inflammation worsens prostate health, and worsening symptoms increase stress levels. Breaking this cycle is essential, and the most effective approach is to integrate stress management into daily routines rather than viewing it as an occasional practice. Simple techniques such as deep breathing exercises, meditation, and mindfulness practices have been shown to significantly lower cortisol and improve the body's inflammatory response. Just 10 minutes of focused breathing or meditation each day can calm the nervous system and shift the body out of fight or flight mode into a state of balance. Physical activity also plays a critical role in reducing stress hormones. Walking in nature, light yoga, or even stretching exercises release endorphins, natural chemicals that counteract stress and promote a sense of well-being. These activities not only relax the mind, but also lower systemic inflammation, benefiting the prostate indirectly. Quality sleep is another often overlooked component of stress control. Lack of restorative sleep raises cortisol and increases inflammatory markers, which can worsen prostate symptoms. Establishing a consistent sleep schedule, reducing screen time before bed, and creating a calming nighttime environment can help maintain hormonal balance. Nutritional strategies also support stress management. Foods rich in omega-3 fatty acids, magnesium, and antioxidants have calming and anti-inflammatory properties, providing an additional layer of protection for the prostate. When it comes to prostate health, early detection is one of the most powerful tools available to men over the age of 60. The reality is that many prostate conditions, including cancer, develop silently without obvious symptoms in their early stages. By the time noticeable signs appear, the disease may already be more advanced, making treatment more difficult and outcomes less favorable. This is why regular screening is critical. It allows problems to be identified before they become serious, often long before symptoms would have prompted a doctor's visit. Screening is not about fear, it is about control and empowerment. It provides men with the ability to take proactive steps rather than waiting for health issues to dictate their future. One of the most common and effective screening tools is the PSA blood test, which measures the level of prostate-specific antigen in the bloodstream. Elevated PSA levels can indicate potential issues ranging from inflammation to benign enlargement, or, in some cases, prostate cancer. While the test is not perfect and must be interpreted carefully by a healthcare professional, it serves as an important early warning system. Alongside the PSA test, the digital rectal exam, DRE, is another essential component of screening. This simple, quick exam allows doctors to physically assess the size, shape, and texture of the prostate gland, detecting irregularities that might require further investigation. For men with a family history of prostate cancer or those who fall into higher risk groups, such as African American men, screening becomes even more important. Genetic factors can significantly increase the likelihood of prostate-related diseases, making it vital to begin regular testing earlier and maintain consistent checkups. Discussing personal risk factors with a healthcare provider ensures that screening schedules are tailored to individual needs rather than relying on a one-size-fits-all approach. Modern advances in diagnostic technology have also improved the accuracy of prostate screening. Imaging techniques like MRI scans can provide detailed views of the gland, helping doctors identify areas of concern without invasive procedures. When combined with traditional methods, these innovations enhance early detection and reduce unnecessary treatments. Despite these advancements, the most important step is commitment, making screening a non-negotiable part of a health routine after 60. Many men delay or avoid these checkups out of discomfort or fear, but this hesitation can lead to consequences far greater than the few minutes spent at a doctor's office. Regular screening offers peace of mind, the opportunity for timely intervention, and the best possible chance of maintaining long-term prostate health.